Assessment of the IGHL can provide valuable information in the diagnosis of a frozen shoulder, but its assessment is not limited to this entity only. This is the image we're after, and the most common question asked is, how do I obtain this image in a patient that does have a frozen shoulder and that can't move their arm? And the answer is, by any means necessary. The only time you won't be able to obtain this image is if someone has acute calcific tendinosis, and in that case we won't need to obtain this image because we've already found the calcium and we've already found the cause for the patient's presentation. The second most common question asked is, where and what do I measure? And that depends on who and what you read. Some measure at the true IGHL and others measure at the axillary recess, and there are varying values that denote the upper limits of normal for both. I tend not to measure because it becomes pretty obvious what's normal and what's abnormally thickened, and if we're ever in doubt we can just compare to the contralateral side. However, there is a propensity to put calipers on everything, but like most measurements in musculoskeletal ultrasound, we need to exercise discretion in their applications for a couple of reasons. The first is that we actually have an anterior and posterior inferior glenohumeral ligament, and we can have asymmetric thickening of both of these ligaments. The second reason is that we need to ensure that these findings correlate with the clinical presentation. If a patient presents with symptoms of a frozen shoulder, that is, they have reduced external rotation, and we see thickening of the IGHL, then we can be reasonably confident in our diagnosis of a frozen shoulder. If in that same patient they also have thickening of the coracohumeral ligament or vascularity of the rotator interval or a biceps effusion, then our confidence levels increase further. If, however, they present without symptoms of a frozen shoulder and we see thickening of the IGHL in the axillary recess, then these measurements become redundant because clearly they don't have a frozen shoulder. Often we'll encounter this, and this is not due to a frozen shoulder, but rather glenohumeral joint osteoarthritis. We can see on the corresponding x-ray quite marked osteoarthritis of the glenohumeral joint. And herein lies the other benefit to IGHL assessment. Occasionally we'll encounter this, an inferior or caudal osteophyte of the humerus without IGHL thickening and without thickening of the axillary recess. On x-ray it appears like this, and this is known as a goat's beard osteophyte, which is a characteristic osteophyte in glenohumeral joint osteoarthritis. Thanks for watching, guys. Like and subscribe for more.